Welcome to part 2 of the case study series highlighting the work the Conceptual Communications team did for the City of Stamford Department of Health. In part 1 of this case study series, we focused in on the work the team did to educate Stamford residents about COVID-19 vaccines, testing, and prevention. In this episode, we are going to discuss the digital campaign developed and launched to get messaging out into the community about lessons learned from the pandemic. Lori, I imagine the work is still ongoing to educate residents about COVID-19. So talk to us about this project and what challenge your team was presented with.
Sure. And thanks again for helping me get these case studies out using this platform.
Oh, it's our pleasure. Lots of fun.
Yeah.
Agreed. So much better than reading. I mean, I'd rather listen to a podcast.
Yes.
Yeah. So, the educational push and the continuous flow of information around COVID is certainly continuing. However, late last spring, some health departments like Stamford's were seeing a clearer path forward. At this juncture, they had 84% of their eligible population fully vaccinated, and they were the second most vaccinated city in the state of Connecticut.
Wow.
Yeah, so we were proud of them and they were proud of their community. And they came to us initially to help communicate lessons learned from the pandemic.
Just to clarify, was the scope or the directive that you were receiving from the city, were they asking you to communicate their lessons learned?
Yeah, it was. But initially, they wanted our help with organizing and promoting a webinar to do that. So they really envisioned a panel type format, and they wanted to hit on 3 very specific areas. They wanted to focus on the Stamford community's response in general, and then primary care and prevention using one of their health professionals, and then mental health using one of their mental health professionals. So it was really a brilliant idea to do a lessons learned type messaging.
Right.
Their community had really accomplished a lot, and it was a good time to focus on the positive and also take some time to show that health departments like theirs had learned a lot through the pandemic. And as a result, they had come out stronger and almost more in tune with how to support their communities moving forward.
So can we assume that you went ahead then and organized a webinar?
Not exactly.
Mm-hmm.
So we actually asked them what their main goal was. And their goal was really to have as many Stamford residents and stakeholders receive this message as they possibly could. Again, it was sort of, I don't want to say light at the end of the tunnel moment because COVID wasn't over and it wasn't ending.
Right.
But they had accomplished and learned so much over the past 2 years, and they wanted the community to get a chance to enjoy that win. So knowing that many people by this point, and I was one of them, had experienced webinar fatigue.
Yeah.
Haven't we all?
Exactly. So we presented podcasting because we knew it was an easily consumable media. And it's also cost effective in comparison to using the professional videographer. And we could, in fact, make it an engaging dialogue. We envisioned something people could listen to on their drive to work or picking up the kids or while riding the train or the bus. So we ultimately suggested, ditch the webinar. Let's do a 3-part podcast series that would hit on the 3 topics that they had already identified. And then with your help, we recorded those. And then we had to figure out a way to get the messaging out there.
Yeah, podcasting is so much more versatile than a webinar.
Absolutely.
Can we assume that this was the first time the department had used podcasting? How did you encourage them or get them on board with this idea?
Yeah, so we had already been really successful reaching their community through social media platforms. So we recorded the podcasts, and then we ended up taking the podcast recordings and putting them into an MP4 file type, similar to what you do for videos. And then we promoted the podcast through social media platforms.
And what results did you get?
The results were impressive. In a 30-day period, we ended up reaching just over 76,000 people, and we garnered just over 77,000 views or case listens.
Wow, that's great.
Yeah, one item that was interesting was the podcast on mental health received just over 6,000 listens, whereas the 2 podcasts that covered the more general overview of lessons learned in terms of how communities responded to a public health crisis received 30,000 views each.
Wow.
So what that showed us was the mental health podcast, and this is totally okay and expected. It hit a more target or niche audience, but ultimately the goal to get the message out there and have as many stakeholders as possible listen and key into the lessons learned worked. Whereas if they would have held a one-time webinar, a webinar of 3 people on a panel would have been much longer than 8 or 10 minutes.
Yeah.
So the likelihood of people listening to that whole recording would have diminished. And this ended up being really successful for them. And we were really proud of that.
That's
And
exciting.
well, you should
Yeah.
be. Yeah, absolutely. Lori, I want to ask a question. What do you attribute your success being with the podcast?
I think just the conversational aspect of it is one. And again, how digestible it is and easily consumable. It's not too long, but it gets the message across. And the data and the amount of views we were able to garner in that 30-day period speak for themselves. I mean, if people weren't into it, we wouldn't have saw those numbers.
Yeah, those are very impressive.
And of course, we're in the public health space, so we don't have tens of thousands of dollars to put behind it. We do get a little bit of money to promote it, but it's not like the same as you'd see in the public sector from a giant corporation to really get more. So we were really impressed with those results. And I think the community told us, yep, we're listening, we're doing it, or we wouldn't have had those numbers.
That's a great motto right there.
Yeah.
We're listening.
Yeah,
Isn't
but
that what you want your community to say? What a great idea.
it's rewarding as well.
Yes.
Lori, this has been very enlightening. Thank you again for sharing your work with us. For more information about the work Conceptual Communications does for their public sector clients, visit conceptualpr.com.